Thanks for staying with us. Georgetown Bariatrics and Advanced Surgical Services is on the forefront of providing metabolic surgery for fighting the diseases of type 2 diabetes and obesity. Troy Thompson sat down with Dr. Eric Smith and registered dietitian and licensed diabetes educator Cindy Jester Caywood to discuss what health problems patients typically experience before deciding to pursue bariatric surgery.
Well, welcome Cindy and Eric. One of the things I wanted to ask you, what do patients experience typically before they pursue bariatric surgery, Dr. Eric?
Well, they go through the process to try to make a decision if they even want to have surgery. So their experience to get to that point oftentimes is getting information from people, whether it be online, and then when they're led to our website, they can start gathering information through the online seminar, seeing videos of the procedures that we do and all the options that we provide.
Well, I remember just recently someone saw one of our interviews and she said, "I'm the perfect candidate, Troy." And I said, "Well, how did you know that?" And she said, "Well, you said I was, and it was because of my weight." How does someone realize that they are the perfect candidate? How do they do that before they see you?
Well, so part of when they go on our website or when they gather information, they'll be referred to a BMI chart, and that will kind of take their weight and turn it into another number.
Okay.
There's a list of comorbidities on there as well that most insurances recommend considering weight loss surgery, such as diabetes, hypertension, sleep apnea, and there's a long list that may cause someone to finally say, all right, not only do I need to change my weight, but I want to get rid of these medical problems.
So on your website, you're listing the symptoms of being overweight, of the reason, the symptoms of the reasons.
Right, yeah. The comorbidities that go along with being overweight. I tell people all the time, people don't die just because they're obese. They die because of the comorbidities that go along with morbid obesity and the complications.
And we don't realize that. We think we're under the radar, but when you put in all those numbers and then list those symptoms that you're experiencing, you then realize, right?
Sure.
Okay, Cindy, let's bring you in regards to dietitian and the work that you do with Dr. Eric. Why is that such an important factor in this process?
Well, it's really a complete treatment. It's the surgery, plus it's making the lifestyle changes. So we don't just have the patients try to figure out those lifestyle changes on their own. We're going to work with them before surgery and after surgery to make sure that they've got the accountability and the support to make that happen. Okay,
well, why do you feel, because you've been part of the team for a little while now, why do you feel Georgetown Bariatrics is a step ahead of all other practices and services?
Well, I think we have the best surgeon in Kentucky, obviously, in the country, in my opinion. But besides that, we have a well-rounded team. So we have diabetes educator, we have a dietitian, we have Heather, our physician assistant. It's really everyone there to support you and to take you through that process. And I think you get more individualized treatment and education at Georgetown than any other place.
So part of that registration factor that everyone goes through, either online or coming in to see you with the seminars, when do you, Dr. Eric Smith, introduce Cindy to that part of the conversation?
Gosh, at the very beginning.
Really?
I mean, their very first visit, I meet the patients the first time they come in, as well as Cindy, and we kind of talk about our own thing. And interestingly, when I first meet the patients, I don't talk a lot about surgery to them.
Really?
I talk about lifestyle changes as well. We talk about surgery, but our focus at that time, early in the process, is that. And one thing I'll say quickly that I tell patients all the time is obesity is a disease, and so you have to treat it as a disease. So if you have hypertension, but your blood pressure is controlled on medicine, you still have hypertension even though your blood pressure is normal. Once you're diagnosed with obesity, you still have obesity even though your weight gets to a normal range. So you constantly have follow-up with us and a dietitian, so you stay on top of it and keep it controlled.
Absolutely.
What do you say to those people sitting at home watching you who are considering bariatric surgery? Maybe they're feeling that little bit nervous to come and see you, because it is a life-changing experience. Cindy?
I would say just make the call. Talk to us. What questions do you have? What can we answer for you?
I agree with her and base it on facts. And the reality of it is, and it's not told to patients frequently enough, that if you take a patient who's morbidly obese and you put them on diet and exercise alone, any plan, any personal trainer, their chances of losing enough weight to get out of the obese category and stay out of that for a year or greater is 1%.
All right.
Ours is 60% or greater.
Well, we appreciate both of you coming in
Thank you.
again. Thank you for great information. If you want to find out more information about Georgetown Bariatrics and Advanced Surgical Service, all the information is up on your screen, and we'll be back after this short break.